outside here is what's called the epicardium. You can see, again, like I can lift up this kind of lining. It looks almost like saran wrap. See, that is the epicardium. Underneath that, we can see here is the myocardium, which is the muscle, and then when I cut all the way into it, we'll see the endocardium. But this outer layer is the epicardium. This stuff here is just like external adipose. It's fat that helps basically protect the heart and keep it like safe. Most of what you're looking at, so this is all the ventricles. I can feel just by squeezing them, so I've done this enough, but you will see this when I cut it open. This side is a lot thinner than this side, so I know that this side is the right side because I know that the right side doesn't have as much muscle because it's pumping out to the lungs, not to the body like the left side. So I know, what I know is because this is the right and this is the left, and if I like hold it up in my body, like this is my left side and this is my right side, that means that this must be the anterior or the front of the heart, and this would be the posterior. Right now, the posterior looks very flat just because of like how it's been like kept inside of the bag with a bunch of hearts, but like you might not be able to tell necessarily from it like being squished in one direction. So the way that I tell is that I figure out what's the right side and what's the left side, and then I'm like, okay, well, I'm gonna put the right on my right and the left on my left, and then that would be how it would be in my body. So this must be the front and this must be the back. Okay, I did anterior, posterior. Okay, apex versus base. So apex in a mountain is usually the top because it's the tip, but in the heart, it's the bottom because the top doesn't have like a tip. So weirdly, this is the apex of the heart, even though it's the bottom, and this is the base, even though it's the top. So that's a kind of weird one. So just be aware that like your innate knowledge of like what top and bottom is will actually not help you here. Like you're like knowing like base usually means the bottom is not correct. You can see here these like little like flappy things. They kind of look like a really messed up ear. These are the atria. So these are the receiving chambers that receive blood into them. This kind of stuff on the outside that looks like a weird messed up like it looks like boxer's ear or like almost like weird little like tumors sticking off the side. Those are the auricles. So they are off of the heart. You can't see them in like those diagrams where you're looking at like a diagram of the heart because they're not showing you like the external area. But these little like ear like kind of like flappy bits, these are called the auricles. And that's spelled A-U, where is it? A-U-R-I-C-L-E, not oracle like the Oracle of Delphi, if you guys know what that is. Okay.
I have a question.
Yeah.
If you cut it open, like, will like blood?
No, so you can see what they've done here is there's a big hole that they've already made so that they can drain the blood. All the way up at the top, all of these things are basically the assorted blood vessels that lead into and out of the heart. The way that you can generally tell veins from arteries is that veins are gonna be a lot thinner. So let me see if I can find a vein versus an artery. Hang on.
So those big tubes sticking off the top of those arteries?
Yeah, so this, one of these, I think this one is the aorta, and you can see like how thick it is. Like it's very meaty. It like looks whiter. This on the other hand, this one is the like inferior vena cava, and you can see like, you can almost see my glove color through it. Like it's not super thin, but it's a lot. If you look at the size of this, and you guys can like come closer if you need to, but if you look at like the thickness of this vessel versus how thick this one is, this one's a lot like thicker, and you can feel it too. Like this one feels just like meatier and like more like tough. So the tougher ones are going to be arteries because they have to deal with the pressure of the blood like being pumped out, whereas the veins, so like for example like these openings are also veins. You can see like they're much thinner. They're not super thin, but they are thinner because they're not dealing with as much pressure. Yeah, Mel.
So when you ask us like if these are arteries or if these are veins, is that a good reasoning? Like,
yeah, you'd be like, this one's thicker.
Glove.
Yeah,
you can see.
Yeah, you'd be like, I feel this one's thicker and that one's thinner. Great, that's how you would know. Okay, if you want to pause the video while I cut this open, just 'cause, I mean, you don't have to, but it just might be a lot more space.
Wait, which one's the right?
The right is like
Oh, okay.
here. Yeah.
Oh, wow.
So what I'm gonna do, there's just flesh there. There's not anything else. Start seeing internally these bits. These are valves, so I don't want to cut those. Those are gonna be the semilunar valves. I don't want to cut those, so I'm gonna stop here. So I'm gonna be like, okay, I've cut like meat, but I'm gonna stop cutting there. Oh, sorry. So like, you see like these bits? And they really, like, again, like they look like a little like boob or like a little like butt. This thing here that's connecting like the two parts of the heart, I just need to slice through that. So I'm just gonna cut it. Then I'm gonna kind of flip this over. It just like keeps this part like connected to here so it doesn't like rip. It's not something you're gonna have to identify. It's just like a thing. So as I look further inside, you guys can see, I'll like turn this around, like you can see like these flaps here. I don't want to cut those flaps inside. Those again, those are going to be the tricuspid. There's 3 flaps of tricuspid. So what I'm going to do is I'm going to come over here, and again, I'm kind of like using my hand. Actually, I'm going to flip this around so that it's a little bit easier for me. So I'm just kind of like expanding this with my hand, but I don't want to cut any of these strings. So I'm just making sure that all I'm cutting is meat. And again, yeah. So if you look, this is the tricuspid valve. 1, 2, 3 flaps. These are the chordae tendineae. And again, I'm going to go through this like more, but and then these little muscles that they're attached to, these are the papillary muscles. Again, papillary means nipple. They look like little like nipples sticking out of the thingy. So the chordae tendineae, and you'll feel like, I'm not going to lift the heart up by them, but like they're pretty strong. Like I can lift the heart slightly up by them. Yeah, Maeve.
What are those like when you were cutting open the heart? There were those little like chunk. Yeah, that. Like,
This thing? Yeah, so this guy like connected here so that the two pieces of the heart stayed together, just to like make like help preserve structure. It's something you can just slice through. I'm not going to ask you about it. Okay. The left side of the heart has already been opened for me by the butcher. So what I'm going to do is I'm like, yeah, I can like feel inside of here. So I'm going to use this and basically just like cut part of this open. And generally going like down inside the heart, you don't have to worry as much. Like, so if you look, this is the right side. This is the side that's pumping out to the lungs. So you can see how thick it is. This is the left side, which is pumping out to the body. It is 2 to 3 times as thick. Like this is not like an unnoticeable difference. So the right side is always thinner. The left side is super thick and large.
Oh, wait, it's thicker because it needs like more strength to pump the rest of the body.
It needs more strength to pump out to the body. Yeah. Okay. So now I've got to cut around this guy. So I'm just like, again, if you're nervous about like what you're slicing, you can call me over and be like, is it okay to slice this?
I mean, I'm alright. I used to.
He used to do this.
Yeah, it's very meaty. Yeah.
So you used to just be around.
So I used to just look at it.
So yeah, like you can see like people like me cutting the scalpel, like the scalpel. So I think we've now gotten into this enough that I can show you everything. Okay, so I'm gonna go around the heart and be like, okay, this is what's like happening. These are the parts, and show you how you can identify them. Can somebody, there's on that table, the glass table, there's a bunch of straws. Can you just pass me, yeah, a few of them. The only way that I can tell is literally I figure out like which part of the heart are they coming into and out of. So for me, the way I do that is I just stick my fingers in there. If you're like, oh no, please don't make me do that. Instead, what you can do, stick a straw in and see where it comes out.
If it goes all the way through, it's what?
It should always go all the way through, but you're figuring out like where is it coming out to. So for example, this one is coming out to the left ventricle, so I know it must be the aorta because that's like what connects there. So this is again when I was saying like what you can do at home is memorize like what's on the right and the left. That is like once I know my right from my left, because I've memorized what's on the right and left, I therefore know like what all the vessels are.
We can like practice with like a heart.
I'm gonna leave this in. Yeah, I'm gonna leave this in the other room. Okay. So to start off, we're gonna start with like blood flow going through the heart. So we're gonna start with the vena cava. So sometimes they give you, yes, they did give us the inferior vena cava. So the inferior vena cava is down here, and it leads into, so I know again, I'm on the right side, and I know that because this is the thin side. So this is the right atrium. So the right atrium has the inferior vena cava leading into it. And you can see like, yes, and my finger is now inside of the right atrium. And the superior vena cava leading in there, which again, you can see that I am now inside of there. Again, what you can do if you're like, if you don't want to stick your fingers in there, is you can like put a straw in and be like, oh, okay, yeah, like see my straw is in that part, so I know what it is. I know that this is the superior and this is the inferior because this one's on the top and this one's on the bottom.
So does blood come in through one tube? And
It comes in through both. So like if it's coming from below your heart, it's coming in from the inferior vena cava. If it's coming from above your heart, like your arms and your head, superior vena cava. That is not something I would expect you, like you don't need to know that, like where it's coming from, but like just so you guys know for this. So, okay, so into superior and inferior vena cava and into the right atrium. Something else you'll notice about the veins is they tend to often be like kind of darker colored than the arteries. The arteries tend to be quite white because they have a lot of elastic connective tissue in them, and that makes them kind of white. So we're into the right atrium. Then from the right atrium, this would pump and move blood into the right ventricle. We can see here these flappy things. This is the tricuspid. So there's 1, 2, 3 flaps, tricuspid. We try to be right. These stringy bits, those are the chordae tendineae. And then, oh, here's a really good example of a papillary muscle. So like you can see here, like again, it like looks like a little nipple coming out of the heart. So that's the papillary muscle that the chordae tendineae connect to. Then once it's inside the ventricle, this guy is gonna pump and send blood out to the lungs. So it's going to, I'm looking for like the other exit out. So I'm like, okay, this was how I entered. So I'm just gonna kind of like move around and be like, oh, so I accidentally cut part of the heart here. That was my bad. And then I'm like, oh wait, here's an exit again. These little cusps here, so you can see, like it looks like maybe like the top of a heart right here, or again, like a butt or like a bra almost. Those are the semilunar valves. So you can see, I can put my finger in there and it's like a little cup. So because this is going to the pulmonary trunk, because that's what's on the right side, this is the pulmonary semilunar. So those are the pulmonary semilunars, and you can see this tube that they're leading out to, this is the pulmonary trunk. So this would then, they've cut off the arteries, but this would then split into 2, and the left and the right arteries would go to the lungs. But they've cut that off because nobody wants to eat like artery. It's gross. It like is just connective tissue and disgustingness. So they like cut that off. So you can see the pulmonary trunk. So it goes out to the lungs. It picks up oxygen. Now it's got to go back to the heart, but we're going back now to the left side of the heart. Yeah, Jeremy.
That sounds really dumb, but you see how like the stuff of here is like fat?
Yes. It is fat.
It is fat.
Yeah,
see, it looks like
exactly. Nope, that's not dumb. It is fat. You are correct. It basically is there like, this looks like a pretty healthy cow heart. It's mostly there for just like padding. Okay, so coming back from the lungs, you actually have, so this heart, does it have all 4? Yeah, oh my God, it does. Okay, this is kind of rare.
What's the difference?
Oh no, it only has 3.
Is there any difference? Is there any difference between this and a human?
Size. Yeah. So these little things right here, and then this entrance, those would be the pulmonary veins coming back. So they're going into the left atrium. And again, I know I'm on the left side because this side is super duper 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 thick. So I'm like, okay, yeah, if I put my fingers into those, I'm inside the other atrium. So these must be the pulmonary veins. Yes, because we're turning to the heart. So we can see there's supposed to be 4 of them. We can see like 2 of them here, and then the other 2 just got like ripped open into like this big thing. So like this would be like coming from the right side. These would be like the 2 coming back from the right side, and then there should be 2 coming from the left, but they got like sliced off. So it's just like coming in here. So now I'm into the left atrium. Again, you can see like the nice little auricles on the side. And then again, basically what I do is I just like keep putting my fingers through, and then I'm like, oh, well, now I'm in the ventricle. So if I pop this guy open, what you'll see is now there is another valve that's like that's got the flaps, but there's only 2 flaps. So there's one flap here, and then a second one here. That's the bicuspid, because there's only 2 flaps. So bi for 2. Again, it's got the chordae tendineae and the papillary muscles that it attaches to. So I know I'm in left ventricle, again, bicuspid valve. The last thing I have to find is the aortic semilunar valve and the aorta. So again, I'm just kind of, I know, like, because I've done this a lot, like where these things are, but you're kind of looking for this like whiter stuff up here. And so you might have to come like kind of close to see this, and let me like point at it, but like these are the aortic semilunar valve. So if everybody wants to like, maybe I can, hang on, let me like slice off some meat off of this heart just so we can like see it a little better.
Yummy. Little snack.
I mean, we've got the hot plates. So you can see like right here, again, I can like put my little finger in it and it looks like a little cup, but these things here that look like, again, they just look like to me like a little like heart, or a little top of a heart or something like that, or a little butt. Those things are the aortic semilunar. And then if I put my hand up in here, you can see this enormous entire vessel, that's the aorta. So this is the biggest artery in the body, and you can see, like, if I like expose this, how large it really is. And then it starts, like the aorta splits off. So like one of these, you can see like in the aorta, there's like a bunch of like parts where it like splits off to. So like some of those would be going to the head, some of those would be going to like the cow's legs, like some of those would be going to like the cow's body, like things like that. But like the main aorta where it leaves is like this, which is like about 4 fingers wide. So quite large. The last thing that I have to show you guys is the fossa ovalis. So this is, if you guys remember, again, so for cows and humans and everybody, when you were inside your mom, you got your oxygen from her placenta and from her blood. You didn't need to use your lungs. So what happens is, in the cow fetus and a human fetus, they have a hole between these 2 atria, and blood just skips over the right side because it doesn't need to go to the lungs and pick up oxygen because you're not breathing. So if you look inside of this part, inside of the atria, let me see if I can find it. Where is it? Oh, there it is. It's actually quite obvious. It was so obvious I wasn't seeing it. So you see how like a lot of the inside of this is a quite pale color, but there's this part. Yeah, let me see if I can like do this so that you guys can see it better. Maybe I just want to cut this open. Do I want to just cut this open? Okay, so if you look inside of here, you'll see there's a part that kind of looks like scar tissue. It's like very white here. And then there's this little there's this kind of like little like hole or divot there. That divot and that scar tissue is where the hole was. So it used to, and you can kind of feel basically like it would connect through to here. And so it basically used to be blood would go from here to here and then out to the body. And so you can see the sort of like scar tissue remnant of it. And it looks like, you can see like this area looks different than like this area. Like it looks, oh, well that might have helped, yeah. So like this area here looks kind of more like scar tissue, like white scar tissue, versus like the rest of the heart that's a little bit more like pinky.
Where do those scars come from?
The scars come from, so that hole has to heal when they are, like when they're born, because then you do want to use your lungs because you're no longer getting oxygen from your mom. So that like hole like heals up essentially. And you always know, so like obviously, like if you know again that the point of it is to go into here, you know like there's no point looking for it like over here because that's not close to where it needs to go. So it's on the side like close over to here. The last thing that I need to show you guys is this thing here that separates, this big thing here that separates the left and the right ventricle. This is called the interventricular septum. So inter being like between, ventricle meaning it's in between the ventricles, and a septum is like a piece of tissue that divides two cavities, just like the septum in your nose. Okay, so I believe with that I have told you yes, where everything is. Oh, finally, actually, I guess I didn't technically do this. So again, we can see like epicardium here on the outside looks kind of shiny. Myocardium looks like meat. And then the inside here looks shiny again. That's the endocardium. So like where it looks kind of like almost like it got like saran wrapped a little bit. Endocardium, myocardium, epicardium. Okay. And that is now actually everything.
Thank you.
Okay. So